During the last decade, we have observed the changing role of intensive cardiac therapy. Increasing numbers of very complicated cardiovascular interventions, electrotherapy, cardiac surgery, and in the same time, aging population with a lot of comorbidities show the new needs in modern cardiology. We observe decreasing number of acute coronary syndrome patients needing intensive cardiac therapy, but in the same time, the epidemic of acute heart failure, cardiogenic shock, valvular diseases, and other reasons for hemodynamic disability. These patients need to be treated in intensive cardiac therapy. Mild therapeutic hypothermia, intra-aortic balloon pumping, left ventricular devices, hemodiafiltration, respiratory therapy. This is everyday practice in the group of patients with cardiovascular diseases. We have a discussion about responsibility of treatment of this very difficult group of patients. I am sure that cardiologists were additionally educated in intensive cardiac therapy are the right persons for that. We need modern intensive cardiac therapy, but we need also to build a system of education and financing modern intensive cardiac therapy.
Welcome in Zabrze, welcome in Silesian Heart Center. In Zabrze you have a chance to see very modern cardiology and cardiac surgery, like new aspects of heart transplantation in adult and children, mechanical assist device, including the Polvadreliga, which is born here, and also very modern axial pump like hardware. You will see a strong ECMO program.
Now we are in one of two intensive cardiac care units of Silesian Center for Heart Diseases in Zabrze. In both departments, we hospitalize more than 1,500 patients with acute heart diseases. They are mainly patients with acute coronary syndromes. All patients are treated invasively. In the nearest future, we would like to provide the best therapy for patients with acute coronary syndromes, especially with cardiogenic shock and advanced heart failure, and also would like to increase the number of patients treated with hypothermia. In our understanding, it is possible when the specialists work together, as is in our hospital, so in heart team.
We are in the University Hospital in Krakow. We are very happy to work here and to see the great development. Nowadays, when we look for cardiac care, we feel that we need intensive cardiac care units due to specific situation with cardiology patients. We need these units for patients with cardiogenic shock and patients after cardiac arrest. More and more often we use hypothermia for these patients. We need to use and to develop programs with cardiac assist devices for acute and chronic heart failure. And many of our patients are after complex hybrid procedures and patients after heart coronary and peripheral intervention with many comorbidities, and we need specific treatment for these patients with cardiologic care, not only care, but rather intensive treatment.
Acute cardiac care, intensive cardiac care is now becoming one of the fastly moving medical disciplines within cardiology. I truly believe that we have given our patients a great chance to be managed much better in a much more efficient way. This is the development we have been observing over the last years, and truly we can't imagine ourselves without this possibility of treating our patients post-myocardial infarction with acute coronary syndromes, post-complex PCIs outside of intensive care units. And I can only say that we are very glad and we very much appreciate the effort Professor Janina Stępińska, who is President of Polish Cardiac Society, has made to further improve this discipline in our country. And I really truly believe that we will develop this further and further. I would like to focus a little bit today on patients who are particularly difficult in terms of complex medical management. These are patients we are observing very often now in our departments, in referring centers. These are patients with advanced heart failure who are admitted due to decompensation. As we know, we are now facing the epidemic of heart failure, and particular problem is actually a growing number of patients with decompensation. These patients are admitted to the hospital. They are often in very unstable conditions. Many of them require intensive care, and then now we can offer them invasive hemodynamic monitoring to improve and optimize management. We can offer renal replacement therapy for several of them. Several of them require inotropic support or even intra-aortic balloon pumping. Some of them may require mechanical device in a very acute stage to survive, and this is also offered in highly specialized centers. So I think that further development of cardiology and further development of heart failure care should include this branch, and I am really very positive looking into the future, as I said, also in my country. I would like to mention that European Society of Cardiology understands this need and the importance of intensive cardiac care very well. And as an evidence, there is a creation of a new association of acute cardiac care. And this new association, which has been just set up, will be officially announced at the new ESC Congress in Munich. And as a past president of Heart Failure Association, which is another association within European Society of Cardiology, I am looking forward for the collaboration with our colleague, and I wish them all the best. Thank you.